So, welcome to this week's episode of the Dubai Doctors Podcast. I'm your host, Dr. Natalia Spierings, and I'm joined this week by a very special guest, Dr. Kiren Sahota, consultant family medicine physician here in Dubai. Now, you might recognize her name because she's been here a very long time. We used to work together at King's Marina for a little while, and you're very well known in Dubai, and so I think a lot of people here will know who you are, which is good.
Fantastic. Thank you.
So your area is a specialty within family medicine. You look at functional medicine and mental health in general.
Yes.
Okay. So today's topic, though, is something a little bit different from what you may have heard of before when we're looking at perimenopause, because Dr. Kiren is interested or has a lot of experience looking at perimenopause and ADHD together in a woman, basically.
Yes.
So that's a bit of a weird one because we're finding that a lot of women are being diagnosed with ADHD in their 40s or perhaps around their 40s.
Yeah.
And but you have an interesting take on this, which I've not heard before. So maybe tell us a patient's story, like a vignette to kind of lead us into this topic.
Of course, absolutely. So first of all, thank you very much for asking me to come along. So I think it's really great to start off with a typical patient. So the 40-year-old lady who has had a fantastic career, wonderful academic life, high flyer. She's got every box ticked. And then, she may have had kids, she may not have had kids. And then she walks in just feeling like her life is just disintegrating in front of her. So over the course of a few weeks, few months, she's finding things difficult to remember. So she's always really tried hard, like keeping mental notes or physical notes of people's birthdays, dentist appointments, where her keys are. You're laughing. Am I ticking some boxes?
Yeah, I know.
For you?
I have a phone. I write everything down. If you didn't see me write it down on my phone, it's never going to happen.
Right.
So, but I'm not 40. I'm 45. But I think that's the age bracket.
But the age bracket. So I'm sorry. I've probably gone ahead two steps too far, but we'll continue the little story. So she thinks that, life is just very, very difficult. She's finding her moods are up and down. So she's getting triggered and really irritable. So things that she could take at work or maybe at home, she just can't, phones being flung across the room. It sounds really dramatic.
Yes.
And we're doing it. We're sort of symbolizing how life can change from this high functioning executive who's able to cope to really not being able to cope. Disorganized, forgetful, sleep is really problematic, more anxious. So she walks in to the doctor's surgery or the clinic and she's told, well, it could be perimenopause. And she's like, what's that? And it's like, well, it's when your reproductive hormones start to dwindle. That can last for 2 years or 10 years. She's thinking, oh my goodness, what are we going to do? And then she's told at menopause is just 1 day, and after that you're postmenopausal. What does that mean? Well, it means that your reproductive hormones, estrogen, progesterone, which were keeping you afloat for a bit, just disintegrate, and then welcome to the world of HRT. Oh my goodness, I'm menopause.
That's a super simplified.
Right. So this is one story. It's really common.
Yeah.
The other story is, well, Kiren, you're depressed or you're anxious or you're burnt out. You're thinking, oh my goodness, like what's going on? So this life I've built, all this, this life that I've built and I've managed to keep afloat is just, like I said, I've lost it. What we're finding, however, that there is a group of people that fall into the range of, yes, you might be going through perimenopause, but actually the symptoms that you've got are those of ADHD.
Right.
And people look at me and think, or they say, well, that means everyone's got ADHD, okay? We're all, like I said, we're all sitting here. If you're in your 40s or in your late 30s, you're ticking out. Yeah. Yes. I lose my keys. I'm a bit irritable. I'm a bit annoyed. I can't keep to time. I'm doom scrolling at my phone at 3 o'clock in the morning when I should be sleeping. Tick, 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 tick. It is very different.
Okay. Yes.
Okay. And one of the questions I get asked is, well, why are we seeing these women now? Why are we labeling them all? Because Instagram tells us that we've all got ADHD. Why are we labeling them that? So they are two different topics, ADHD and perimenopause. And you can have ADHD without being in the menopause, and you can have perimenopause without being ADHD. What we're looking at, we're putting them together. And the reason that people are presenting is ADHD and perimenopause are connected because your hormones affect your neurotransmitters, and your neurotransmitters are really affected by your hormones. So what is a neurotransmitter?
Yeah.
These are your happy hormones.
All right. So people talk about dopamine.
Dopamine, right? Okay,
Yes.
or serotonin. Go for a run. You want serotonin? Go for a run.
Yes.
Lift some weights, Dr. Natalia.
Lift some weights.
Right?
Yes.
So they're your brain. It almost like they keep your brain active and healthy. They help with organization. They help with your mood regulation, memory, attention. Lovely.
Yes. Good.
But what we find is that reproductive hormones in women, especially estrogen, is almost the scaffolding for those chemicals.
Right. So so I've not come across this concept.
Have I lost you already?
No, not yet. I hope not everyone else. But not
Sorry.
me. But so I've never come across that idea. But that's also because this is not my area. But that, which is why you're here. So where your estrogen progesterone is your scaffolding for your dopamine, serotonin levels.
Yeah.
Okay, just explain that more.
Yeah. All right. So we've all got this system.
Yeah.
And in women, your estrogen specifically keeps your dopamine and serotonin systems going.
Right.
Now, in people with ADHD, their dopamine systems are less active. They have less dopamine.
And what are the symptoms of that in ADHD context?
In ADHD context. So it's really interesting that you say that. Like, obviously, it's you can have poor attention, poor memory, disorganization, poor motivation. Mood can be affected. So you might be more anxious. And people say, well, why is it coming out now? It's because with the help of the estrogen, these young girls that became then these women were able to compensate.
Right.
They are brilliant actresses. They can what we call mask.
Yeah.
So it means that the exec that would take 30 minutes to make a presentation actually in the ADHD world gets that presentation done and does a remarkable job. But she spent 4.5 hours on the 30-minute presentation.
Right.
She underlines everything to make sure there are no mistakes. She will over-rehearse, over-prepare, right?
Right.
And what happens? And therefore, they're like I said, they're masking and they're keeping it all together.
Yeah.
And it's fine.
It's fine.
Because we've got the scaffolding.
Yeah.
Then we remove the scaffolding and collapse.
So is that a different pathophysiology or underlying cause than when it's in children or teenagers?
So fantastic question, right? So if we revert back to kids,
Yeah.
one of the reasons that women are coming through in perimenopause is not because they didn't have the symptoms in childhood.
Oh, okay.
It's because they masked, number one. Number two, if I said to you ADHD in a 6-year-old boy, what comes to mind?
I think like a kid who's like bouncing off the walls and very distracted all the time. I mean, I have them in the clinic sometimes, they're spinning in the chair and like just a little irritating.
Yeah.
I'm like, put down.
Put it down.
Yeah, exactly.
Against the wall.
Exactly.
Right.
Yeah.
So the diagnostic system wasn't actually created for women or girls.
Okay.
You're right. So actually the hyperactivity bit, you can have ADHD without the hyperactivity. And in the diagnostic process, you can have inattention or hyperactivity or you're mixed.
Right. Okay, fine.
And so women and females tend to be diagnosed up to 30 years later than their male counterparts because we're not spinning and we're not standing on our heads or throwing things.
Girls present differently than boys.
They can do, yeah.
Okay.
And not just that, but they like I said, girls and boys are different, and females are able to mask. Males mask as well, which is why there are some males that get diagnosed later, but females are able to mask. So they will, like I said, they'll spend hours being super anxious doing their homework because they don't want to get told off, or they don't want criticism. And if they get any criticism, it really affects them. They then seem to be oversensitive or a bit too dramatic,
Right.
bit much. And actually, one of the things that we say, or I say to patients is, okay, let's look at this. You've got an array of medications in front of you and it just still doesn't feel right. Yeah, I'm in perimenopause and I've slapped a patch on, or I've taken some supplements, or I'm doing some Reiki And I'm taking, do you know what I mean?
Yeah,
and the list goes on. They come in
on.
with basically like a wheelie suitcase with all the
Stuff in
supplements
it.
and drugs and skipping ropes and whatever else they're doing, sound healing bowls. It's not working.
It's not working.
And it's like, right, let's start from the beginning.
Yeah.
Let's okay, you're here. Let's rewind. I want you to go back to when you were a kid. And let's think about, how did the teachers describe you? Yeah, okay, you're an exec in this big company, you're a doctor, you're a lawyer, you're an engineer. Let's go back to grade 1 or year 1. And it's really interesting because you'll get some people who are told that they're just not quite reaching their potential.
Right.
Too much, like I said, too much, too dramatic, too theatrical, talk too much, can't concentrate. And unlike the little boys where parents remember, oh yeah, God, they were a nightmare. They're running into the street and, jumping off cliffs and things.
Yeah.
So it can be a bit more subtle.
Right.
And like I said, they then learn to compensate. So I'm talking about women who are my age, who were growing up in the 80s and 90s, where the system was quite, if you just behave and you sit, you kind of go under the radar and no one picks on you and you don't get shouted at by teachers. Thankfully, things are much, we're in a world, I've got 2 young kids, their schools are fantastic and they're open to what the child needs. I'm sorry to say, when I grew up and when I went to school, it didn't work like that.
Yeah, I don't think it worked like that.
Right?
Yeah.
Like you just
80s and 90s.
You just fit. And if you didn't fit, you were the naughty kid.
Yeah.
And there was something wrong.
Yeah.
Like I said, for parents out there, I do know some of the schools around here, and obviously I've been here for 12 years. The schools are very different. They're very they look at the child, mind, body, soul, spirit. And that's what we are.
Yes.
And I think for people our age, the mind, the body was definitely counted, but the mind, the spirit, and the soul definitely were sort of taken out to the equation.
Yeah, yeah.
And imagine then you get to your 40s and it's boom. It's like, oh yeah, I've got these other sides, and we haven't worked with that.
Yeah.
So sorry, long-winded way of saying the diagnostic system wasn't created for women and for females in general. Females were really great at masking, especially in our day.
Yeah.
What happens now, like I said, these are people that we would have gone to school with.
Yes. Yeah.
These are our friends.
They're friends.
So who are high functioning individuals. They have achieved, they've got through it all. And then they wake up and it's like, I'm not feeling right. And this feeling isn't going away.
Right. Okay.
And it's like I said, it's the organization. It's that feeling of, oh God, before I could have done all of this in a day and now I can't even be bothered to start. I just can't do it. And it's not laziness. And then they beat themselves up about, well, I could do it before. What's going on? So it's tough.
So when you have a patient come in and let's say they haven't gone at anything and the presenting complaint to you is, I just don't feel like myself. I'm forgetting things. I'm 41 years old. I used to be able to do like exactly what you just said, these kind of symptoms. So how do you then decide if it's just perimenopause or just ADHD? Like blood tests, like how do you go about looking into it? Yeah.
Fantastic. So anybody who knows me knows it's not, first of all, it's not, well, we've been together for like 2 minutes. It feels like we've been a lifetime.
Yeah, totally.
Discussion.
Yes.
Open conversation. And we're not going to figure it all out in
10 minutes.
10 minutes. You can't.
No.
And anyone who claims that is lying to you.
We need more time in the consultation.
We need time. We need trust. We need connection.
Yeah.
And I say that honestly because it can be quite daunting, right? I think again we're in this mode of you expect an answer, and then you leave
with a pill,
maybe with a pill,
maybe a prescription,
and if you don't, you feel like you're hard done by.
Yeah. All she did was talk to me.
Exactly.
That wasn't a consultation.
I could have called my mum.
I could have ChatGPT'd this.
Exactly.
If people don't get that.
But
it takes time.
It really takes time. And often what we do is I am quite nosy. So
yes, so am I.
Yeah, are you?
Yes.
It's like I want to know you.
I want to know everything. Everyone's like, a dermatology, you don't need to know everything. I'm like, yes, I do.
Yeah.
That's why my consults are so long.
Exactly. Thank you very much.
Like mine. Yeah, totally.
And sorry for the next patient. And I'm running late.
Yeah, I'm so sorry.
It's really important. So we really do start. I always find out why have you come today? What is it that's driven you today? Because that will be our lovely starting point. And what are you hoping to get out of this?
Yes.
If someone's just like, I need a sick note, it's like, okay, we can get to that. And that's really important. But I do also want to know, like, when you're here, I want to know what is going on. And so we really delve deep. So I tend to start with current day and then I work backwards.
Okay.
And sometimes people are like, well, this is really like what my mum's pregnancy was like is not really useful. And you're looking at me like, how is this useful? So ADHD is not just plucked from the air and we just sort of bam. It is a neurobiological, neurodevelopmental condition.
And there's no blood tests for this because people ask me that actually. Is there a blood test for ADHD? I'm like, no. Not that I'm aware of.
Not yet. But with all the longevity clinics that are opening up, there might be something in the pipeline.
Maybe. But yes, I'm always like, no, there's no like scan or anything. It comes down to like having someone who understands the condition ask you the right questions and getting the information from you.
And firm diagnostics. I can't say whether someone has ADHD or not. Okay. There are a series of experts, so psychologists,
psychiatrists,
occupational therapists, and different types of testing that will look at executive function. So that means your planning, your organization.
So Dr. Rebecca here, she does these assessments and they're booked in the schedule for like 4 hours.
Yeah, I saw her outside and she was like, I was like, I'll see you in an hour. She's like, no, I'm there for 2. I'm like, assessment.
Okay. And they come back again for a second part of their assessment. I'm like, what is going on in that room? Like, because I haven't actually asked her those questions, but I've seen the forms and stuff. I'm just like, I don't know. But she's like, it takes a lot of time. Like you have to ask make them fill out all these things and ask them all these questions, all these assessments to get to the bottom of it.
Exactly.
It takes so much time.
It takes a lot of time. The interesting thing that I sort of learned was in kids, I understand they check for whether there is a learning problem, but they do in adults. They will look at as well as your planning and your functioning through questionnaires and assessments. They will look at your IQ.
Oh my God! So is that like an IQ test?
To check. Yeah,
I would never have that checked because I'm like so worried. I'm really low.
I am so worried as well.
It's like 72. Like, oh my God!
It's like we've sort of prided ourselves. But and not that it's a problem, but exactly that, because it's not just this tick box of, oh, you're really great at this and you're struggling with this. There are patterns with it. So, for example, you can have, I've met a professional who on paper, and when you meet them, you're just like, wow, you're so together. I want to be like you. I'm crushing on how together you are. And then they come and they're like, look, doc, I'll look at my report, like my executive function, which is the organization, the planning, the ability to get stuff done is they're in her boots. It's in her boots. The score is so low. Oh, so it just shows the level of compensation this poor woman has been doing all this time.
But that's exhausting, having to compensate all the time.
Exactly.
Okay, yeah, that's what I was thinking. Yeah, it must be exhausting. I need to do these assessments. How do I get these?
Right, well, send a stamped addressed envelope to this address. Do you remember that? Because we were born in the 80s and 90s.
Yeah, so we'll send you back your assessment.
Yeah. In all seriousness, it is exhausting.
It's exhausting. Yeah.
And the drain on the individual is huge. And they do it and they do it and they do it. And when they can't do it any longer is the day that they walk in saying, Kiren, I can't do this anymore.
Yeah, right.
And it's sometimes it's almost like the way that I see it myself. This is what is called a midlife. Finish the sentence.
I was going to say crisis, but I feel like it's a trick question.
No, it's a trick question.
It's a trick question.
It's a trick question. A midlife awakening.
Oh, awakening. Oh, that's much better.
All right.
And it's for females, not for men. Men can have midlife crises.
Yeah, of course. You can have your crises by your Porsche. No, that's really sexist.
I know it's really sexist. We'll have an awakening.
Yeah. In all seriousness, everyone is having an awakening.
Yes.
Because there are crucial changes that are happening in our biology, and that does make us shift lots of things. It makes us shift, oh my God, the way that I have been coping, almost feeling like a hamster on a wheel just to feel like I'm keeping it together, is not serving me anymore because it doesn't work.
Right. Okay.
Right?
Yeah.
And that's why I'm saying it's an awakening, being like, you know what? You've worked really hard to get to where you are, wherever that might be. And you have always felt like you're working maybe harder than everyone else, or that you're really trying to keep it together. And then finally figuring out like, wow, despite this midlife, this score of I can't, like this executive functioning being low, I've been able to do A, B, C, D, or I haven't been able to do 1, 2, 3 because of it. Now, it isn't something that people are like, oh, it's just an excuse, I get it, right?
Yeah,
I've obviously been here for a very long time, and it's like, well, I can't do that because of A or because of B, and that's fair. But there are lots of things that we can do to manage it. But I think the struggle is real, and I think the flippant comments that I've heard amongst my group of friends, it's like, well, everyone's got ADHD. And it's like, right, well, no, they don't.
No.
They don't have it because they haven't been struggling to keep it together and masking. And those high functioning people that you're just like, oh, they're a bit edgy, or they're a bit irritable, or they're a bit too much, are just keeping it together. And so once we know, we can do something about it. All right. So there are, again, I work very much of a Mickey Mouse science. People can say Mickey Mouse. It's not Mickey Mouse. It's real. Mind, body, soul, spirit.
Yeah. I mean, that's like holistic.
Holistic.
And we like that. And all of healthcare should be holistic.
I think so.
Right. But we've never used that term until I think more recently.
Where people are accepting it.
They're accepting it. Yeah. Where I'm like, well, no, but that's always what doctors do. Like I look at the whole picture, even though I'm just looking at your skin problem, but your skin problem is much deeper than just your skin.
Of course.
There's all this other stuff I have to take into account before I decide on the treatment for you. I'm like, well, how much is this impacting your entire life?
Exactly.
And people don't realize that that's actually a big part of it. So they're like, why do I need a consultation? It's just a rash.
It's like, it's so much deeper than
But it's so much more. It's not just skin deep. It's much deeper than that.
Exactly. Totally. Exactly.
So yeah, I mean, that's so with this, if you look at the holistic picture, of course, well, you have to do that when you're looking at whether someone may have ADHD. So if you think that someone's going down that diagnostic pathway, then you would send them off to get assessed properly.
Yeah. So we like I said, it takes a little bit of time. We do. So we'll start off with like any consultation. So we'll take a thorough history. If we need to examine, someone says, and at the same time I'm really sweaty and I've put on a lot of weight. Okay, fine. Let's check all of that. We do a full exam. I don't go straight to ADHD.
Yeah, of course.
We will do bloods. So we will check, typical things like your thyroid function, your iron. Iron is you need iron in order to make dopamine. You need iron to make everything.
A lot of things.
Iron is involved in fatigue. Iron is involved in mood.
Hair,
skin. Doc.
Yes.
We will talk about your gut. Yeah. So it's not just skin deep, right?
Yes. Skin deep.
So your gut is involved in everything, as we know.